The superior limit of the femoral triangle, a subfascial triangular space in the superomedial thigh, is formed by the inguinal ligament, which is the aponeurosis of the external oblique muscle attaching laterally to the anterior superior iliac spine and medially to the pubic tubercle. Its lateral border is the sartorius muscle, which performs flexion, abduction, and lateral rotation of the hip along with knee flexion, while its medial border is the adductor longus muscle, primarily an adductor of the hip. The deep floor of this triangle is not flat, but rather a depression composed laterally by the iliopsoas muscle and medially by the pectineus muscle. The apex of the femoral triangle is defined by the intersection of the medial border of the sartorius muscle and the medial border of the adductor longus muscle, marking the point where the femoral triangle communicates with the adductor, also called Hunter's or subsartorial canal. Superficially, the area is covered by fascia lata, the deep fascia of the thigh, which has a significant opening called the saphenous opening or fossa ovalis, allowing the long or great saphenous vein to join the femoral vein by piercing the cribriform fascia that spans across the opening. Located deep to the fascia lata and located within the femoral triangle, the femoral sheath is a descending fascial tube formed superiorly as a continuation of abdominal fascial layers, specifically the transversalis fascia, which continues inferiorly to cover the anterior aspect, and the iliac fascia, which forms its posterior wall. It is essential to appreciate that the femoral sheath itself only extends inferiorly about 4 cm below the inguinal ligament and does not enclose the femoral nerve, which is the most lateral significant structure in the triangle. The contents of the triangle from lateral to medial are remembered by the mnemonic navel, which stands for the femoral nerve, femoral artery, femoral vein, and the femoral canal, leading to an empty space containing lymphatics. However, the femoral sheath only contains 3 of these, being divided internally by 2 thin fibrous septa into 3 distinct separate compartments: a lateral compartment, an intermediate, and a medial compartment. The most lateral compartment of the sheath contains the femoral artery, which is the primary arterial supply to the lower limb, arising as the continuation of the external iliac artery once it crosses deep to the inguinal ligament.